thank the Minister for his availability and continuous support to UNODC and its efforts. I appreciate the traditional leaders for their energy, enthusiasm, and commitment to the validation of the action plan, and also to support to take concrete actions forward and fully participating in this validation meeting. This is a huge step, and I wish you well in this journey. UNODC understand the seriousness of the drug problem and the growing numbers of persons with drug use disorder in South Africa in general and in rural communities in particular. UNODC supports evidence-based, informed, gender-sensitive, human rights-oriented policies and programs to address drug use prevention and treatment. Since we understand drug use disorder is a chronic relapsing disorder, what is required is treatment of drug use disorders, not punishment. We need to move away from coercion to cohesion. UNODC stands committed to provide all the support required by the traditional leaders to strengthen their efforts in dealing with drug use issues in the society. We also would be happy to support the high-level chairpersons forum that will act as a convening body to roll out plans and programs at national and provincial levels on drug demand reduction.
And we have now a document which is fondly dubbed the People's NSP, which is the one towards 2028. It's got 4 goals, and all of these goals speak to the issue of drug epidemic issues in South Africa. Goal 1 speaks to addressing social and structural drivers. Goal 2 speaks to equitable access to high-impact prevention and treatment interventions, including harm reduction services. Goal 3 speaks to strengthening systems for health and making sure that those are integrated into social systems for pandemic preparedness. Because whatever we're doing here, we don't want the next pandemic that comes to wipe out all our efforts because our systems are not ready. So we have to be anchored within social systems. And then Goal 4 speaks to governance and leadership, as well as shared accountability. And I think this is what we are learning by this particular forum as well, that partnerships don't just come to be. So with that, I'd like to applaud the efforts of this particular meeting to strengthen this critical initiative, which started last year. I think as SANAC, we once again confirm our commitment to walking this road together, and we also support the call to action. Because if we are going to win this, it cannot be business as usual. If we are going to leave no one behind, we need to make sure that everybody has a seat at the table and that everyone has a voice at the table.
Now that the critical role of traditional leadership in drug demand reduction interventions has been affirmed, and the drafters of the national action have explored to a great extent the potential roles of traditional leadership in DDR interventions, it is time that our focus shifts sharply to the assessment of the needs of traditional leaders for their effective engagement in drug demand reduction. We are here in the past 2 days as traditional leaders, as bodies of the United Nations Organization and the African Union Commission, as well as other departments, including Department of Correctional Services, Department of Cooperative Governance and Traditional Affairs, and others from the Departments of Health and so on. The main objective is to validate the commitments that were made in similar gatherings in the past year, where there was an introduction of this matter of the problem of drug abuse in a number of countries in Africa. The idea is to ensure that as a continent, we are aware of the dangers of drug trafficking to the health and lives of our people, especially the young. And we are a receiving continent of drugs. And at the same time, we are a continent that is used in order to spread on a wider scale these drugs that are dangerous to the health of our people. But the organizers and the funders have indicated that the best place to start is South Africa. I imagine because the execution of traditional leadership in South Africa is very much organized outside of government and also within government. Outside of government, we have the Congress of Traditional Leaders of South Africa, which is a body uniting all traditional leaders in the country. Its efforts resulted in the establishment by the Constitution and other laws of the national, provincial, and local houses of traditional and Khoisan leaders, plus the reconfiguration and recognition of traditional councils, which are the main instrument of the ability of traditional leaders to be able to deliver services. The problem of drug abuse affects in the main the poor and the vulnerable. Some are used as drug mules, some are used in order to sell them, others are just used in order to be able to help destroy the lives of other people. So it's important therefore that an institution as important as that of traditional leadership is involved and is in the forefront of all efforts that are aimed at ensuring that these lives of our people are protected and defended.
Traditional leaders have established a partnership with AU and UN structures. As the royal leadership in this country, we are also deeply affected by this scourge of drug and substance abuse. We are going to do our best in making sure that we use our traditional offices, we use our traditional councillors, we use our sporting codes, we use all the schools, we will use our clubs that are there in our communities. When in spreading the message, that will make sure that we get the support from all those affected people. The scourge of drugs and substance abuse is destroying our community, and it's worrying us as royal leadership. There is a saying that goes that you are what you are because of other people. Therefore, it is we're making this commitment to say, let's fight this together. We're very happy that the AU and UN are really coming on board as well, and we're very grateful that they now were involving us as leadership to fight this scourge, and we're hopeful that we're going to win this war.
The current leadership of traditional leaders in the country is seeking to business re-engineer traditional leadership towards developmental monarchs. Because as I look at these sustainable development goals, they are talking to us as traditional leaders. And why the institution of traditional leadership is key. It is because it is strategically placed in rural areas. 2, we command sufficient legitimacy, respect, and insight to indigenous knowledge systems. We're easily accessible and we're trusted by communities. Even our proximity to the toiling masses is a strength for the institution. We are a unifying thread across class, political, and religious lines. So for purposes of coordination, we have 30 local houses in the country. That works at a district level. So you'll have your drug and alcohol committees that we talked about at that level, even at municipal level or at traditional council level. That will feed to 7 provincial houses in the country, and then the national house at national level. So for purposes of coordination, we can use those existing structures to advance this revolution.
Karibu senza mura,